Today is Thursday, March 26. This is the news on PBCJ. I am Simone Absalom. A 70-year-old male from Clarendon is Jamaica's 26th case of COVID-19. Health Minister Dr. Christopher Tufton provided the update Wednesday at a press conference.
So over the last 24 hours, we've had one additional confirmed case, which has placed our numbers so far to date of COVID-19 here in Jamaica at 26. So 26 confirmed positives. Of this 26, 17 are imported cases, 8 are import-related cases, and 1 is still under investigation. The new case is a 70-year-old male from Clarendon who is a son-in-law of the one person who was deceased from COVID-19 to date here in Jamaica. This person has no travel history and is linked, of course, to the individual who passed.
The ministry is awaiting 18 other test results. Jamaicans 75 years and older must now remain indoors and only go out once per day for food, medicine, or the necessities of life. The order restricting the movement of these persons took effect on Wednesday and does not include engaging in employment. Prime Minister Andrew Holness addressed concerns at a digital COVID-19 town hall session on Wednesday. Marlon Samuels reports.
Responding to concerns at a digital COVID town hall session, Prime Minister Andrew Holness says special provisions have been made in the government's COVID-19 stimulus package to provide financial assistance to our senior citizens. Mr. Holness added that these persons may also seek help from the Ministry of Local Government.
Anyone who is in this age group that has a situation that would lead to distress, now is the time to reach out, as you have said, to the Ministry of Health, but you also, the duty lies with the Ministry of Labour and Social Security and the poor relief, which ties in to the municipal council. So once you reach out to those agencies, they are all empowered to be able to respond to these specific circumstances.
And Prime Minister, just to say, if we get that information provided, I will instruct the Poor Relief Department to check and to make the arrangements, because a part of the working of the Poor Relief Department, not only if you are not even a registered poor or an outdoor poor, there are still provisions under the Poor Relief Act for us to take that kind of steps to exercise some level of humanitarian discretion.
The Prime Minister said the government is aware of the challenges, and that's why provision was made in the stimulus package. The package was outlined by Finance Minister Dr. Nigel Clark in Parliament on Tuesday.
So we want you to, as much as possible, follow the order of the government, which is to stay in, but you are allowed to conduct once per day the essentials of life. Now, if that restricts you from earning, and we know that there are many persons who earn, I had a conversation yesterday with the Minister of Finance, who announced a significant package. It was not clear in that package that there was a special provision, but there is a special provision which we will be making more details available of as to how we can assist persons who for the next 14 days are required to stay at home, but who would not be able to continue to earn to sustain themselves. Again, if you are in that position, there is always the responsibility and duty that falls on the Ministry of Local Government and the Ministry of Labour and Social Security. Reach out to them and provisions will be made.
According to the World Health Organization, the WHO, seniors are one of the most vulnerable groups to the COVID-19 virus. The measures introduced by the Jamaican government are in line with recommended protective protocols. For the news on PBCJ, I am Marlon Samuels.
Help is coming for Jamaicans battling chronic health diseases. Health Minister Dr. Christopher Tufton says the government is seeking to forge an estimated $350 million public-private partnership agreement with private health providers to treat 75,000 Jamaicans living with these diseases. This would ease the burden on public health facilities and hospitals should the country begin to experience community spread of COVID-19. Speaking at a virtual press briefing, Dr. Tufton said the arrangement was in answer to the question of how the health sector would fare under the added numbers.
We have taken a decision that in the coming weeks, we are going to engage the private sector under a public-private partnership arrangement, PPP, to outsource some of the services that are currently being carried out in our public health institutions, our hospitals in particular, to minimize, to reduce the numbers of the comorbid conditions or patients with those underlying conditions in our hospitals, and by extension reduce the health centers, and by extension reduce the risk of community spread within those health centers.
The health minister says his team is focusing on two highly vulnerable groups of persons who have chronic hypertension and diabetes.
This number, based on our clinic sessions, numbers about 75,000 across the country, based on the database we have within our institutions. And the idea here is to outsource those two sessional visits by this population to private practitioners who will see them once or twice per month. And we want to do this for approximately 4 months in the first instance.
Jamaica is not yet at the stage of community transmission of the COVID-19 virus, so says Chief Medical Officer Dr. Jacqueline Mackenzie.
So what we see on the previous slide were clusters of cases, clusters meaning that you have cases that have arisen out of linkages to the imported cases. The WHO has described now 3 stages of within the outbreak in terms of the type of transmission that is seen. The first stage is where we have no cases, and the second stage is where we have sporadic cases. Sporadic cases meaning that we would have had 1 or 2 imported cases and maybe a few cases that would have been linked to them. Cluster of cases is where we're seeing now that we can see definite linkages to the imported cases, and we're seeing more than 1 or 2 of these relationships. So right now we would have about 4 such clusters, not large clusters, the largest being from our first case where we would have seen 5 confirmed cases related to that case.
And Dr. Mackenzie says, with regard to general surveillance to determine whether there is community transmission, the Health Ministry has been conducting tests on all severe acute respiratory cases admitted to hospitals, healthcare workers with influenza-like illnesses, and a number of persons who present to hospitals with influenza-like symptoms. She says this will provide a network of samples representing all parishes, which would allow them to detect whether there is community transmission.
The next step is when we have community transmission, and community transmission is when these cases start to pop up within communities where we cannot identify the link to an imported case. Many persons may have come into country undetected by the surveillance system. They may have been in the communities, been in contact with other persons. These persons might have traveled to other areas. And so at the point of them presenting to a healthcare facility with symptoms suggestive of COVID and maybe tested positive, there is no definite link that we can trace to an imported case.
In the meantime, she says the Health Ministry is exploring the idea of using rapid test kits and should within the next 3 days decide on the type of kits appropriate. Public spaces across corporate area will be sanitized by the Kingston and St. Andrew Municipal Corporation, the KSAMC, as part of measures to reduce the spread of the novel coronavirus disease and create a clean city. The scope of work will include the washing of sidewalks and disinfecting high traffic areas. Mayor of Kingston, Senator Delroy Williams, says sanitizing high traffic areas where you have rails that people hold on to, especially at bus stops or at the terminus, is their goal. He says the corporation will be scouring St. William Grant Park and sections of Halfway Tree and downtown Kingston. Mayor Williams says the corporation is working to curb this unsanitary practice of using the toilet in public spaces. President of the Jamaica Hotel and Tourist Association, JHTA, Omar Robinson, is confident that the 600 hotel rooms being sought by government to accommodate COVID-19 patients will be realized. He told the press that there is ongoing dialogue between the JHTA members and government. Mr. Robinson says information has been sent out to JHTA members, most of whom are in the process of closing their own hotels and taking stock. He says a few hotels have reached out and discussions are taking place with respective parties. Health and Wellness Minister Dr. Christopher Tufton recently expressed the need for rooms to house the infected COVID-19 patients.
The last time we announced that we needed approximately 600 rooms to support the efforts at quarantining and isolation outside of the hospital setting. And we justified that on the basis of our projections, if we were to have, when we have community spread, and on the basis that the virus, even when one is asymptomatic, having recovered from the signs that are manifested when you have the virus is still active and could be active for a number of weeks. And so we needed to lodge those persons in a facility that would provide isolation boundaries, but not be a high intensity or an ICU unit. So we needed these rooms, if you will, accommodation that we were seeking to source external to our hospital setting. We have started that search and we have had a number of offers. The suitability, however, of those facilities in a number of cases are a challenge. Either they're too small, or in some instances the costs are prohibitive or are high based on the private provider's requirement. And so the search continues.
The public is reminded that all UDC-owned attractions remain closed during this time, in keeping with the national health concerns and restrictions on public gatherings. These attractions are Dungeon Falls and Green Grotto Caves, Ocherius Bay Beach, Reach Falls, Pearly Beach West, Long Bay Beach Park, Bluefields Beach Park, Turtle River Park, Walter Fletcher Beach, Laughing Waters Protocol House. Additionally, the UDC advises that all venue rentals are suspended until further notice. For all inquiries during this temporary period of closure, you can email cr@udcja.com or call 876-353-2011 or 876-869-5173. As the government prepares for possible community spread of the COVID-19, Petrojam Limited says several measures are being implemented to ensure business continuity and, by extension, Jamaica's energy security. Petrojam says since the first case of COVID-19 in Jamaica, it has taken a number of measures to maintain an adequate inventory throughout this pandemic. The measures include at least 21 days inventory of crude oil and finished products such as gasoline, kerosene, diesel, and liquefied petroleum gas, cooking gas. Constant communication with suppliers of both crude oil and finished products. And Pbcj has modeled several scenarios that could impact operations and have implemented strategies to ensure resilience through this COVID-19 pandemic. This includes organizing a backup or fail-safe manpower system in emergency operations to ensure consistent availability of critical personnel to man the facilities. Internally, the company has also embarked on a public education campaign promoting enhanced personal hygiene measures, including frequent hand washing, social distancing, proper cough etiquette, among others. Motorists should see a decrease at the pumps in the price of gasoline and diesel effective Thursday, March 26. According to the Pbcj latest ex-refinery costs, 87 and 90 octane gasoline will be sold for $124.18 and $127.02 per litre respectively, down by 50 cents each. Automotive diesel fuel will be sold for $123.05 per litre, following a decrease of 20 cents, while ultra-low sulfur is down by 10 cents and will be sold for $127.99 per litre. Meanwhile, kerosene decreased in price by 40 cents and will be sold for $102.45 per litre. Propane liquid petroleum will be sold for $39.39 per litre, down by 15 cents. And butane liquid petroleum will be sold for $45.44 per litre after a decrease of 25 cents. Do remember, marketing companies and retailers will add their respective markup to these prices. The US dollar is being traded at $135.65, down by $1.32, according to the Bank of Jamaica's daily exchange trading summary. The Canadian dollar is being traded at $94.43, up from $94.08, while the British pound sterling is being traded at $162.30, up from $159.89. In regional news, cases of the novel coronavirus increased steadily across the Caribbean, with the twin island nation of St. Kitts and Nevis as well as the British Virgin Islands yet to be affected. As of Tuesday, March 24, the region has confirmed 662 cases of COVID-19. Some welcome news from for the Caribbean is the instances of recovery increasing over 400%, which indicates that 13 patients have overcome the coronavirus in the Dominican Republic, 3 in French Guiana, 6 in Puerto Rico, 1 in Jamaica, and 2 in Aruba. The death toll, though, is at 12. As of Wednesday, the number of reported COVID-19 cases in Guyana remain at 5. We get more in this InfoHub report.
Minister of Public Health, the Honorable Valda Lawrence, giving an update on COVID-19 locally, said that with rising numbers in new infected cases and deaths globally, mandatory quarantine and isolation has been recommended for a few persons in Guyana.
We have a number of persons quarantined by the Ministry of Public Health on the mandatory quarantine. There are 9 such persons. And the number of persons put in mandatory isolation by the Ministry of Public Health is 4. The number of persons of interest to us that are being followed nationally is 1 person.
From a process of contact tracing, there were at least 7 persons of interest, but after assessments, she said there is only 1 such person still on the watch. The minister also explained that persons who would have been quarantined or isolated will undergo psychosocial support from the mental health unit as part of the ministry's response to the impact of COVID-19 locally.
The ministry's response, 8 pillars set out by the World Health Organization, is as follows. The Health Emergency Operations Center, the HEOC, continues to implement the National Strategic Plan, meeting every 48 hours for updates, in an effort to monitor the COVID-19 situation to mitigate the spread of the disease. Regional preparedness is also ongoing. Also, there is an adequate supply of testing kits and the PPEs for our medical personnel.
Meanwhile, heavy emphasis is being placed on preventative measures, with the most touted being social distancing. The ministry now intends to provide the nation with daily updates concerning the coronavirus, via a live broadcast which will be streamed through the Public Health Ministry's page and the National Communications Network.
Dominica has reported 7 cases of the novel coronavirus. In an address to the nation on Tuesday, Prime Minister Roosevelt Skerrit provided an update.
Since I spoke to you last, Dominica recorded its second imported case of coronavirus. Earlier today, I was informed by the Minister of Health that health authorities have confirmed 5 additional positive testings associated with one of the 2 cases already under observation. This brings to 7 the number of confirmed coronavirus cases in Dominica. This means that at least 5 persons are known to have contracted the virus as a consequence of coming into contact with one, in one way or the other, with one of the persons who was tested positive and who would have brought the virus from abroad.
Mr. Skerrit outlined measures that his administration will use to try and curb the spread of the virus.
I wish to announce this evening that the Commonwealth of Dominica shall suspend all commercial air and sea access to non-Dominicans effective Thursday, the 26th day of March 2020, and to all travelers, including Dominican citizens and residents, Saturday, the 28th of March 2020. This order relates to all commercial aircraft, as well as non-essential service-oriented pleasure craft. The same order of March 28th applies to ships, boats, and yachts not visiting Dominica for the express purpose of bringing vitally needed cargo and other supplies to this country. All air and sea arrivals must henceforth be granted permission to enter by the Office of the Chief Medical Officer. This suspension shall remain in effect until further notice.
The Prime Minister also spoke to other preventative and containment measures.
Movement to level 3 also carries with it ramifications for social gathering, or as it is now commonly called, social distancing. Ladies and gentlemen, the coronavirus is contagious, highly contagious. It is spread largely through person-to-person contact, as well as from droplets left on surfaces and clothing. We need to minimize the spread in Dominica. Accordingly, I am today advising that with immediate effect, all non-essential gatherings in Dominica must be contained to no more than 10 individuals. Essential gatherings for the purpose of this regulation can be defined as workplaces, supermarkets, public transportation, bus stations, health institutions, and any other as might be permitted by the Chief Medical Officer. Non-essential gatherings would therefore include restaurants, churches, sporting and recreational facilities, gyms, cinemas, nightclubs, bars, and most government offices, including the Financial Center and the Ministries of Government.
The Prime Minister appealed to entrepreneurs and business owners to be creative in conducting business in a way that ensures that the economy continues without risking mass exposure to the virus. He also urged good hygiene as well as protection for seniors and for persons with pre-existing medical conditions. In sports, we bowl off with cricket as the governing body of the World Cricket, the International Cricket Council, remains hopeful that the Men's T20 World Cup will be played in October as planned, despite the spread of the coronavirus. The tournament is set to run from October 18 to November 15 in Australia. And Jamaicans drafted for this year's Indian Premier League 2020 could take a big financial hit as the spread of the coronavirus threatens the cancellation of the tournament. The likes of Sheldon Cottrell, who was bought by the Kings X1 Punjab for a whopping price of $1 million, could end up without a dollar from the event, as the ongoing COVID-19 pandemic might see the cancellation of IPL 2020. It's reported that while the franchises are bracing for the worst, top BCCI officials too don't appear to be very optimistic. A total cancellation will see the BCCI losing an excess of $266 million in revenue, while each franchise will lose more than $13 million, and compensation is not an option. India on Tuesday announced a 21-day lockdown to deal with the spread of the virus. Andre Russell, O'Shane Thomas and Fabian Allen are other Jamaicans drafted for this year's staging. Organizers of the Caribbean Premier League have revealed that they have no plans at the moment to adjust the start date of the 2020 edition of the tournament this summer. The 2020 season is slated to run from August 19 to September 26 at 6 venues across the region. In a release, CPL stated that they are in constant dialogue with medical advisors from Cricket West Indies and feel it is too early to consider rescheduling the tournament. The Barbados Tridents are the defending champions of the competition. And that's the news on PBCJ. Do continue to stay safe.